Hey listeners, it's Lindsay Smith Rogers, producer of Public Health on Call. And for 2 years, we've brought you COVID-19 and public health news. But the podcast is just one of the ways you can learn more about the evidence and experts from the Johns Hopkins Bloomberg School of Public Health. If you like what we've been doing on the podcast, please consider subscribing to our e-newsletter, Expert Insights, which publishes on Tuesdays and Fridays. The newsletter contains the latest on how we're working to understand, manage, and eventually end the COVID-19 pandemic and prepare us for future outbreaks. We also cover the school's groundbreaking research and insights on climate change, mental health, racism, opioids, gun violence, and more. You can find our work at publichealth.jhu.edu/subscribe. That's publichealth.jhu.edu/subscribe. We so appreciate you being part of our public health community.
Welcome to Season 5 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former health commissioner here in Baltimore, Maryland. Our goal with this podcast is to bring scientific evidence and experience to shed light on critical health issues. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, listeners. It's Lindsay Smith Rogers, producer of Public Health on Call, and today we have a very special episode. I've pulled quotes from a podcast about the public health response to the pandemic that Dr. Josh Sharfstein recorded in early March 2020 that never aired. In this look back to the beginning of the pandemic, we're going to talk about what he predicted correctly, for better or worse, what he got wrong, and what we still don't really know. Let's listen. Josh Sharfstein, thanks so much for joining me.
Hi, Lindsay. How are you doing today?
I'm good. So we are 2 years out from the launch of the podcast. Can you believe it?
It's hard to believe sometimes how long this pandemic has lasted.
March 3rd, 2020 was the first episode of the podcast. And I've brought you here today because I want to talk about The File. You know what The File is.
I think I know what you're talking about,
Okay.
But maybe we should explain it to people.
Yes. Would you like to explain it?
So pretty early in that first month, I was getting a lot of calls, actually really from the start of the reports of the new virus. In China, I was getting calls from journalists, and then I started getting calls from podcasts, including, some of my favorite podcasts. And one of these podcasts wanted to do an interview with me, which was pretty exciting, but they only could do it late at night. And so it was late at night, I hadn't been sleeping very much, and they wound up keeping me on the phone for like a really long time. So I did this really long, intense, what I remember as kind of intense, somewhat personal podcast interview. And I hung up and I was like, wow, that's going to be hard to listen to or different. I didn't know what to expect. And then the days went by and the weeks went by, and they never put it on the air.
They never aired it.
They never aired it. So somewhere out there in, someone's file was this interview that I did at the very, very beginning of the pandemic that was pretty intense. And so I started to wonder whether I could get a copy of it. And I started emailing around, and I sent an email. I didn't hear it back for months. And then out of the blue, when we were in one of our podcast meetings, I got a message back with the file attached.
And I said, don't open it.
And you told me not to listen to it. You said you wanted to listen to it.
Yeah.
And because you wanted to ask me about it for a podcast.
Yeah. I couldn't think of a better way to look back over the last 2 years than to start at the very beginning. And the way that I'd like to structure this is I've pulled some quotes out of that podcast. I wanted to play the tape for you and just have you react in real time, and this would have been a really cool YouTube video, but unfortunately we can't do that.
We should explain why.
Well,
we explain why. We tried. We went to the publisher of the podcast to see whether we could get approval to use an interview that they never aired. And what they said was we could read the quotes, but we couldn't play the quotes. So just to be clear, I never opened the file. I don't remember, other than that it was intense, this discussion from the very beginning of the pandemic.
Yes. And so we're going to do this like deposition style. So I'm going to read you some quotes and you're going to read some quotes that I'm going to send to you in our Zoom chat here because, and first of all, we should acknowledge that 2 years into this thing, we are still on Zoom. um, but it's really interesting. I was really surprised by just how much we didn't know then. I really sort of take for granted now. And by just how much we'd sort of been caught off guard, despite people like you and experts having spent, their whole careers thinking about these things. And, one of the very first things you mentioned 2 years ago was that you were really concerned that public health wasn't set up for success from the get-go. So I'm going to read this quote from you, and then I want to get your input on, just give us your initial reaction. Okay, so here's the quote. We don't have much of a capacity in public health departments because we've let it wither. And now we have a pandemic and we absolutely need the strongest medical system, but we also need to do things to prevent the spread of infection. And we've done relatively little in the first few weeks to really scale that up. The bright spots that I see are the ingenuity that people are putting into finding PPE despite the shortages, the amazing commitment to standing up research trials very quickly to try different things, availability of new tools like antibody tests, and the fact that there are governors and mayors stepping out to ask people to do things for the greater good. There is a lot to like about the U.S. response. I don't think we are as bad off as we might think we are in terms of our ability to respond. There are parts of our culture that make it harder, but we have some advantages. Wow.
Well, that is an interesting quote where I recognize clearly the challenges facing the public health system, but maybe I was kind of hopeful that we would be able to overcome them with some leadership, some sacrifices for the greater good, and some ingenuity. I think that, in some places that was true. In some places there was just some tremendous work that was being done that was early on, but that fundamental lack of capacity in public health for the length of the pandemic really proved to be a weak spot. And, if you think about why we've had 900,000 people die, I think the weakness of our public health system is one of the major reasons.
Yeah, and we have to acknowledge that number, 900,000 people. And I mean, that just feels mind-boggling at this point. And I think, one of the dynamics that we've sort of had to deal with through the pandemic is this concept of, individual people, 900,000 people, and then the collective. And another recurring theme in your concerns is at the onset of the pandemic, people weren't really thinking about the public health response at large, or at least the average person wasn't. The average person was really thinking about their own risk and safety. And this is still true. We still get tons of emails to the public health question at jhu.edu email from people asking about their individual circumstances and asking, how can I keep myself safe? What do I need to know? So I want to read this quote from you. Think about testing. People perceive testing to be something they get for themselves to see whether they should go to the hospital or what they should do. But testing really makes the most sense in a public health context where you're testing people with certain kinds of conditions and symptoms, and then you're doing things to actually help them reduce their risk of spreading that to someone else. That is the public health response. I have a renewed appreciation for how little we think collectively about the challenge and how much we think about the individual's access to things.
I think that was a prescient comment, if it coming early in the pandemic, that certainly you can't blame anyone for worrying about their own risk, right? Everybody is allowed to do that. You're supposed to do that. If people aren't worrying about their own risk, who's going to worry about their risk? But from a testing perspective, it's more than just people running out to figure out whether they have COVID right now. You wanted to be able to test people and then help them stay safe, help other people around them stay safe. That's the contact tracing, the isolation, the quarantine, all the things you do around testing. And, I was pretty amazed at how little attention was being paid to that early on, and hopeful that there'd be a lot more attention. Only in some places was that really true. I don't think most people really linked the idea of testing to the interventions that can follow testing that really reduce the spread of the virus. And that's been a real weak spot in the US response compared to other countries where somebody tests positive, people show up with money, with food baskets, with video cards, with all kinds of things to help people stay safe at home so they don't infect other people. In the US, it's been like, you get your test and, in many places, that's it.
Yeah. And, because this whole podcast is not going to be like a downer, by the way. Like we're going to have some light moments. But, one of the other things that you talked about later after this quote was when people were thinking of the healthcare system, and when we first started talking about flattening the curve, you were saying that was really one of the first moments that people bridged that connection between the individual and the collective, and that public health was that bridge. And I think that has carried over. Perhaps we didn't do all the things we were supposed to do to help people keep safe, but just the understanding in the public of, we all are a part of this. I mean, I feel like that to some extent has evolved a bit.
Well, I would give myself a point for saying that the whole flatten the curve thing and people need to stay at home to protect the healthcare system is some collective thinking right there. That has faded, though. I think most people are less concerned about that. And of course, there's just been this huge movement against what people call lockdowns. And I think it's been a struggle, the response of the individual and the greater good. And I think you still see that struggle playing out in all the fights that are happening about the pandemic.
I want to actually send you this quote because this is along those lines about what, as a collective society needed to understand. And at the beginning, from your purview as a public health expert, you knew this wasn't going to be a 2-week lockdown. The way I think some people thought. But you had a very thoughtful way of saying that. So I'm going to drop this in the chat here, and I want you to read that quote for us.
All right, let's see. I have not seen this in a year. Our
2
lives
years.
have 2 years. 2 years, you're right. Our lives have just been completely upended. From one week to the next, people have found their ability to go to work, school, see friends totally upended. It's shocking, and you can see the restlessness, like, how long do we have to do this for? It's going to be a while in order to get through this. The collective understanding of that and our ability to find a temporary new normal that allows that to be possible is really critical to making it through with the fewest number of people dying. And there's an awful lot of that on the line.
Ouch.
Yeah, well, it's true. And, we did get through that initial phase. I mean, New York's hospitals were overrun for a period, but it was not the complete collapse that people feared. There was a moment of solidarity early on, but by the time you got into April 2020, that really started to break down, and people sort of decided that any kind of new normal was for the birds, and they wanted to go back to the old normal. And I think that was a bit of the fracturing that happened, aided and abetted by statements the president made and other people sort of calling the whole thing overblown and unlikely to really amount to much.
I mean, do you think, though, that just this extended period of uncertainty, like if people had been told from the very beginning, this is how long we're going to be in this phase, and this is how long we're going to be, it might have been a little bit easier to understand. But part of what exacerbated all of this is we don't really know, we had no concept. So do you think extended period of uncertainty kind of exacerbated that kind of restlessness?
Yeah, I think that's true. But of course, there was no alternative to that. We didn't know. It would have been impossible to tell people this is exactly how long we're going to ask you to do this for. And that's really hard. And eventually people, get upset about that, I guess. And it didn't really take very long in this country for people to decide that kind of thinking wasn't going to be all that useful to them. And then suddenly you got this huge amount of pushback.
Yeah, and there was something else that grew out of that. So this is a great segue to our next quote. And that is that conspiracy theories tend to flourish in these periods of uncertainty. And so I'm going to read this quote to you. Conspiracies tend to flourish when people are afraid and uncertain, and particularly when there isn't a really solid and credible source of good information. Rumors can be quite harmful because they can lead people to overdose on a medicine that hasn't been proven to work for something, or decide that the whole thing is a conspiracy, or that we don't have to follow the advice of the government. I wish our listeners could see your face right now, because you're just like, were you a fortune teller at that point? Like, did you know the future, or how?
Well, there are other public health crises where this has happened, and so this is pretty common. And in periods of uncertainty, rumors really do flourish. And it's just so important to have good communications about what's known, what's not known, and to try to maintain credibility and trust. And when that broke down at the beginning, it is no surprise that all these somewhat, crazy things started to happen. And I might have been on target about that, but if you had asked me then, would I have foreseen where we are now with so much viral misinformation, disinformation, keeping people from getting a life-saving vaccine, I don't think I would have predicted that.
Let me ask you this, because I feel like this begs the question. What if we had, because you said this has happened with other public health things in the past, and we've read about these things, and we've talked about it in our book club when you talked about the plague, and some of these other classic books. Was it inevitable? Even if you had great communication from the very beginning, don't you think that this still might have happened to some degree?
To some degree, but to a much lesser degree. I mean, very early on, we went from being, all kind of in it together, with even President Trump saying we need to do this for a few weeks, to the president saying time to liberate Michigan, and attacking health officials for expressing concern. And I think that there is no substitute for strong leadership and strong communications. And when we didn't have it early on, it was like rolling out the red carpet for rumors and misinformation. And, I don't think I would have predicted just how damaging that's been, but I give myself a point for predicting that it would happen and it would be damaging.
Josh, you've done pretty well with these so far. You're giving yourself a lot of points on these, but I'm going to throw one at you in the chat here. I think, you might need to read this quote here. I'm just going to give that to you. Go ahead. Why don't you read that?
Quote, in terms of mild illness causing a problem, I have not personally seen reports like that. And I think for coronavirus, generally, this is probably on the unlikely side. Seems like they might have been asking a little bit about long COVID.
Mm-hmm, mm-hmm.
I mean, in my defense, it was pretty early, so it was hard to know whether there were long-term consequences. But I think, deserve a minus point for this one, because one of the real challenges we've seen is that people can be stuck with consequences, sometimes even after a mild illness. And that's something that I don't know how well that was really understood before, but certainly I know one person who didn't understand it, and that would be me.
That was a very doctor answer. The original quote, I mean. All right. This next one, I'm going to have you read, and I'm going to send it to you, but we're going to move into the future a little bit. You talked about how some countries in Asia had done a much better job at the beginning of the pandemic than the US or some other European countries because of their experiences with viruses like SARS. And so I'm going to drop this quote in the chat here, and I want you to read it for me. And then I'll give you my follow-up question, which I'm sure you're going to know what it is.
So what I'm reading here is, quote, they developed systems, a cultural understanding, the recognition that extreme action had to be taken to protect society under this enormous threat. There's a much better level of preparedness because they've had that experience. We're not going to come out of this experience and say, well, thank God that will never happen again. We're going to come out of this and say, we have to learn this lesson so that however bad it is this time, it's not nearly as bad the next time.
Do you want me to ask the question, or do you want to just...
Well, I think, I hope that I was right back then, that I hope we are going to come out of this and say, we have to learn this lesson. But truthfully, the jury's still out, and we're in the process of trying to figure out what lesson to learn in this country. And I think that's a lot of the work that has to be done in 2022.
Do you have any final thoughts you want to share, like 2 years later, where we are now?
Well, I guess what I'm taking from this is that it wasn't unforeseeable how hard this would be for this country. Because of the weakness of our public health system, because of the likelihood that misinformation would come up, we didn't know exactly what was going to happen early on, but that, it wasn't too hard to see that this would be really difficult. Still pretty different from living through it. The living through it part was very hard. And we're obviously still in it. I do hope, though, that we realize that a lot of this was unnecessary and they can be prevented for the next time, can help us stay healthier every day. And, year 2, we're kind of starting to pick our heads up a little bit and look around. I hope that by year 3, year 4, we are really learning those lessons, and we can say that we're building healthier and more equitable public health systems. We are building a more responsive medical system. We are figuring out that we have to do things together in order to protect all of our health. I think that there's still a lot of existential anxiety that I have about that. Even if I know a lot more about SARS-CoV-2, I don't really know a lot more about exactly what's going to happen in this country. And I think it's really important if we actually say, well, thank God that won't happen again, and just go along with our lives, we really will have missed an opportunity in a sense and put ourselves in graver danger.
I think there's a lot of people out there who agree with you. So thank you so much for joining us today, Josh.
Thanks, Lindsay.
Public Health on Call is produced by Joshua Sharfstein, Lindsay Smith Rogers, and Stephanie Desmond. Audio production by Niall Owen McCusker, Matthew Martin, Spencer Greer, and Holly Cardinale, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media support from Grace Holz Fernandez. Thank you for listening.